Hello, this is Bill Griffin. Welcome to the Different Take podcast. And the different take today is that it is important to pay attention to what people say and do, but it may be more important to listen and pay attention to what people do not say or do. And today I want to talk about what Anthony Fauci has said and done, and more importantly, what he has not said and done. Anthony Fauci is a political person. What I mean by that is he is a leftist. There are two reasons that I say this. First of all, for the last 2 years, he has been on media constantly, magazine covers and lots of television shows, and he rarely appears on any media that is not left-wing. Now let's think about this. If you were an evangelist preaching the gospel, you wouldn't only speak on certain channels. You'd take every opportunity, if you were a true believer, to spread the word. If you were a doctor treating patients, you wouldn't care what their political leanings were. You'd treat them. But Anthony Fauci, being the top of the government in terms of disseminating public health information regarding COVID, pretty much only speaks on left-wing media. So that is one reason that I say that he is a leftist. The other reason that I think Fauci is a leftist it's obvious that he's a leftist, and I think he would admit that as well, is that he's made several unnecessary comments that have nothing to do with public health. One was criticizing Ted Cruz and talking about January 6th. That has nothing to do with public health. He's made other such comments. But he believes in the power of government to fix all of these problems. Many problems that society has. And I don't think that's, I don't have a problem with him being a leftist if he tells the truth and does his job as a public health expert. Well, let's look at what he said and done. If you recall, back in March 2020 and before that, there were some wild predictions that were used by the government that were not true. And let's just look at some of those. For example, the government used the Imperial College of London's prediction that 2.2 Americans would die from COVID-19. So this has proven to not be true at all. As of today, there are a little over 788,000, which is far and away from 2.2 million. The issue with the 788,000 that Fauci and the government has never talked about is how many of those people would have probably died anyhow. If you don't know someone in your life or have never heard the story of someone really being at death's door, but they tested positive for COVID, that is marked as a COVID death. So the 788,000, I do not know how many of those people would have died anyway. And I think it's imperative that the government tell us how many people truly died from COVID instead of with the virus at the time of their death. The CDC has said something like 96 north of 96% or 94% this was reported in September of last year, include something like 2.6 comorbid conditions, such as cancer or clogged arteries or something of that nature. So the 788,000 number can't be higher, just can't be. So how much lower is it? But either way, if you don't believe me, you think it's higher, and they're not reported high enough, why doesn't the government just tell us the truth? So that is one of the reasons that I have zero respect for Anthony Fauci. If you disagree with me, I hope you hang in there, because I have some other unanswered questions. But going back to March of 2020, there was a lot of fear being spread, and fear is dangerous. I don't see how anybody can argue with that. There were some wild stories put in the media that, generally speaking, they're never corrected. For example, there's a lot of examples of this, but I'm just going to share one. This is from a person named Molly Jong Fast. She is a writer. She's fairly popular on Twitter. I think something like 800,000 followers or something. But anyway, she tweeted in March of 2020 this. This is in regards to the shutdowns, her response to people that question whether shutdowns were necessary. She says, the idea that the economy will function normally while 2 to 7% of the population die is insane. Okay, that means she really believes that something like 7 to 25 million people in the United States would have died from COVID-19. She still has a job. She still gets paid to write this kind of stuff. It's just shocking how much fear was going on at that time. And she wasn't the only one that was spreading this stuff. But nobody ever goes back and says, oh, well, weren't you wrong about this? And why were you wrong? And that sort of thing. One of the things that Anthony Fauci and the government, as a spokesperson for the government, he also made the comment that, or discussed this in Congress, the case mortality rate. So Fauci says this at a congressional hearing, March 2020. Quote, the flu has a mortality rate of 0.1%. This virus has a mortality rate of 10 times that. That's the reason I want to emphasize we have to stay ahead of the game in preventing this.
The seasonal flu that we deal with every year has a mortality of 0.1%. The stated mortality overall of this, when you look at all the data, including China, is about 3%. It first started off as 2 and now 3. I think if you count all the cases of minimally symptomatic or asymptomatic infection, that probably brings the mortality rate down to somewhere around 1%, which means it is 10 times more lethal than the seasonal flu. I think that's something that people can get their arms around and understand.
So 10 times the flu. The interesting thing about this, whether he was correct or not, proven out to be correct or not, there's no way he could have known that at this time, according to Jay Bhattacharya of Stanford. Jay Bhattacharya says, in answer to this question from Peter Robinson an interview on March 31, 2020. This is Peter Robinson asking the question, what's Dr. Fauci up to when he says that this is 10 times more lethal than the flu? He cannot know that. He should not be saying that. He cannot know, can he? Jay Bhattacharya says he doesn't know. He goes on, yeah, and he can't know because nobody has done that. It has already started with this serologic testings, how many people in the population have antibodies to the virus. So that's what you need to know. So this is Jay Bhattacharya, medical health or a healthcare expert, Stanford University, makes the claim there's no way he can know this. And it's proven that it can't possibly be true, that it's 10 times more lethal than the flu. That's not, that's nobody will agree with that. Dr. Fauci would not agree with that, but he does not say this in his many, many media appearances. The other thing is that I think is important is that there are many physicians that it's conventional wisdom, according to the left-wing media, that it was universal, almost universally shared that shutdowns were the way to go in the United States and across the world. Well, this was not shared by many physicians, world-class physicians, world-class experts, Nobel Prize winner Michael Levitt, Amish Adalja, who's the senior scholar at the Johns Hopkins University, Scott Atlas, Carol Sikora, who was, I believe, with the World Health Organization, Michael Osterholm, who agreed with the shutdowns, made the comment that it was like the wind. Well, if it's like the wind, there's no way to stop it. How do shutdowns really make much difference? We'll get to that question, unanswered question, in a bit. Johann Gesicki, Anders Tignall, Carl Hennigan. So there's a lot of people that did not agree with this idea that shutdowns were the way to go. One of the things that Fauci does not mention and did not mention or poo-pooed the idea that there were costs involved with shutdowns. Costs such as people not getting cancer treatments, fear, hopelessness causing suicide, drug overdoses, stress, alcoholism, employment bankruptcies cause stress. What happens to children in foster care that have to be kept indoors for months on end? Heard Dr. Fauci talk about the importance of exercise and proper diet. Isn't there a downside to closing schools and businesses? How about untreated mental health illnesses? And isn't there an uptick in violence, crime, domestic abuse, child abuse? Stands to reason, doesn't it? Folks with diabetes might have a situation where they don't go in out of fear, prolong their condition to the point where they have to have a limb amputated. So these kind of things, and on top of that, the restrictions of freedom, such as religious expression, freedom of assembly, and there's a cost to our normal way of life. But Fauci tends to poo-poo those things, and in my opinion, just doesn't give them much much credence. And the most important thing is to stop the virus. So Fauci has never expressed in his many media appearances an end game. There's never an end game. So this thing could go on forever. You're listening to the Different Take podcast with Bill Griffin. I'm discussing the many things that Anthony Fauci has not said or done. One of the terrible predictions that was made early on, and the government's response to this, which Anthony Fauci is fully on board, and since then being a spokesman has not addressed, is the idea that 1 million plus Americans, if you look at this chart that's up next to between President Trump and Deborah Birx, there's a chart in which they claim that from 1 million, well over a million, 1.4 million to over 2 million lives would be saved simply from the shutdown, because the hospitals would be so overcrowded that physicians wouldn't be able to treat those patients. This turned out to be not true at all. The left-wing media has not addressed this. Actually, not many media outlets at all have addressed this that I've seen. This was a wild prediction that did not come true. If you remember this time, the supposed epicenter of the virus was in New York City. And there's a hospital ship that was brought in to take care of overflow on people that couldn't get treated, and it was never used. There were temporary hospitals being planned or maybe even set up, I don't recall, but they weren't used. In the rest of the country, and where I live, hospitals were empty. The patients where did the sick people go? Weren't they still, elective surgeries are kind of important for long-term health and also just living a better life, but they weren't done. Hospitals were empty. The sick people were still sick. People were fearful, so fearful that they wouldn't go in to get treatment. And some died from another cause. So does the government tell us what these numbers are? No. Does Fauci address the fact that the government predicted, and he was on board, over 1 million to 2 million people would die simply because there weren't hospital beds? He hasn't done this. Why should we respect someone who can't tell us the truth? The other thing that I think is questions that I have is, if there is a statistical difference between this, because we know this now, it's almost, in March, it'll be 2 years since the shutdowns started. California shut down really hard. Georgia was the first to open, if I understand, of the ones that did close. And then Florida was open soon after that. Their restrictions were few. And if there was a statistical difference that shutdowns really mattered, the data's there. Why doesn't the government share the data, and why doesn't Anthony Fauci tell us what that is, so that we would know that the shutdowns were worthwhile, so that if there's another pandemic, that would be an appropriate government policy? But he does not do this. The interesting thing is the left-wing media and social media, they take the supporters of shutdowns would say, Well, show the data. Well, the citizen shouldn't have to prove, doesn't have the burden of proof in this matter. I don't think so. I think it's the government's burden of proof, burden to prove that shutdowns are necessary. In regards to mask mandates, if there was statistical difference between states that didn't require masks, such as Florida, and states that did, such as California, what is it? Where is it? Dr. Fauci, why don't you tell us what it is? And the reason he doesn't tell us what it is because I don't think he cares. It's not what he has said and done that is most troubling to me, and I think for many, many people. He doesn't work to gain respect by answering the questions that are really obvious, and you would think if you lost your business or if you lost a loved one, you'd kind of want to know whether it was worthwhile or not. Where I live to this day, I see people driving in cars with masks on. I see people wearing masks outside to go, and I see with all the folks that have been vaccinated and so forth and so on, wearing masks in supermarkets and in restaurants, all servers wear masks, and it's just that there is no end game. What is the end game? So without coming out and saying it, Anthony Fauci firmly believes in eradication strategy, complete eradication of the COVID virus. But he won't tell you this. Now, I believe this is because there's, frankly, part of it, I think in his head is, well, if I ever say the coast is clear, I don't get to get on TV anymore. And I'm really digging the adoration, and I'm digging the attention, and I don't want to give that up. He impresses me with that. Regarding his style, just speaking, he has a very direct way of being vague. And what I mean by that is this. Take any Anthony Fauci quote anytime, and you'll pretty much, they're very similar. So he says this is on November 29th, 2021. This is 20 months after the shutdowns, the world shutdown. He says, you don't want to frighten the American public, but when something occurs that you need to take seriously, you take it seriously and do whatever you can to mitigate against that, period. So in this sentence, he's saying nothing. He's saying nothing. I don't want to frighten you, but you have to take it seriously. The next sentence, I'm saying this absolutely clearly. Stop. He doesn't say anything absolutely clearly. That if there was a reason for unvaccinated people to get vaccinated, for those who have been vaccinated, when your time comes up to go and get a booster shot. This is very vague because he goes on, we want to make sure we're prepared for the worst, and that's what we should be doing. Okay, this is in regard to the latest variant. So, is there a booster shot for the latest variant? Will it be effective? Maybe so, maybe not. But the interesting thing here, and what makes it so vague, is that he doesn't discuss, and he's never discussed, that if you've had the disease, are these vaccines truly necessary? And there's a lot of debate about that, but he doesn't discuss this. The style is, I find him to be quite quite arrogant. I think most people do. He's not direct. He's a bit of a windbag. And as I said, he only picks the media outlets that that won't challenge him. On the other hand, if you really want to hear what I think would be a much better alternative to Dr. Fauci in the way he approaches things, is there's a very good, an interesting interview by a gentleman. It's called Lockdown TV. It's on Unheard. So if you go on YouTube and you look up Unheard, there's a video titled "Why Lockdowns Are the Wrong Policy," Swedish expert Professor Johan Gesicki. And this gentleman, in a very direct manner, not pompous, he admits when the government's doing the wrong thing, and he gives his honest opinion as he sees it, backed up by data, and it's very hard to argue with. This interview was done April 17th, 2020. And I think this is the exact opposite of Anthony Fauci in his demeanor, and he does not attempt to overstate or sell anything. Anthony Fauci, and I always find this to be a red flag, he sounds as if he's trying to sell people on what needs to be done instead of just delivering the facts. And this is the actions that we're taking. So I don't think Fauci has met any burden of proof in convincing the entirety of the American public that shutdowns were necessary, that mask mandates were necessary, and because of these unanswered questions, the vaccine, which may be just, and with many people, I'm sure it's a great thing to do, but for people that are hesitant, why would they believe they should take a vaccine when he doesn't answer these other basic questions and has never explained, convinced people with strong evidence that the shutdowns and masks were necessary and that their projections were correct from the beginning. They weren't overstated, or if they were overstated, why they were overstated, and let's have the real truth on things. So I have zero respect for Anthony Fauci. I know a lot of people that find him quite loathsome because of the things that he doesn't say, not the things that he says. So in summary, I think people, especially politicians, it's important to listen to what they don't say, and Fauci is a classic example of this. Well, I really appreciate you listening to me, and I hope you check out our website, the platforms that we're on, and if you have any comments at all, you disagree with me, I'd like to hear from you, and thank you very much.